Good morning and welcome to the Public File. I'm Doug Thomas, and my guest for this segment is Dawn Green. She is the president of the Huntington's Disease Society of America, Northern California chapter. Good morning, Dawn.
Good morning. Thanks for having me.
I'm so glad you're available this morning. We're here to talk about the Sacramento Team Hope Walk going on next Saturday, September 24th at Riverwalk Park in West Sacramento. We'll get into that in just a little bit, but first, what is Huntington's disease and how are you personally affected, Dawn?
Well, Huntington's disease, also known as HD, is a brain disease that's passed down in families from generation to generation. It causes deterioration in someone's physical, mental, and emotional abilities, usually in their prime working years, but there also is juvenile Huntington's disease. It's described as having ALS, Parkinson's, and Alzheimer's simultaneously, and currently there's no cure. I am impacted or have a relationship with Huntington's. My husband had Huntington's, who passed away 3 years ago. And so I've seen this life cycle of Huntington's and what it can do for families. So I've just stayed involved in hopes to help however I can.
Well, first of all, I'm so sorry to hear about your husband, and I'm so happy to hear that you've decided to pay it forward and help others who are dealing with a similar situation.
Thank you.
Well, let's talk about the process of getting tested for HD, Dawn.
Okay, so the process for getting tested is a little different whether you're symptomatic or non-symptomatic. So like in Tom's case, my husband, he was symptomatic. So it was really a simple blood draw that determined the blood, whether you have Huntington's or not. And even though it's a simple test, it's a very personal decision and can really weigh on someone's, mindset, whether they want to know whether they have Huntington's or not. And if they are not symptomatic, then there's some genetic or pre-testing, even psychological type, conversations that would happen, because it's a big decision to find out whether you have something like Huntington's that may not develop symptoms for 10, 20 years after you have this diagnosis. So we have lots of information on HDSA website about testing and how people can go about that.
It's like a combination of ALS, Parkinson's, and
Alzheimer's.
oh my goodness, that is not a triple play that you want to be any part of, right?
Absolutely not.
Well, do you feel like the medical professionals aren't quite up to speed on HD? Should there be more of a focus on HD in med school?
I think that would be wonderful if there was more of that. I think people know about it, but I don't think they really know the more psychological part of it. Huntington's disease manifests in having chorea and having a lot of physical symptoms, but a lot of the kind of psychosomatic type symptoms are really not as well known in our medical professionals. And one of the things HDSA does is we do provide a guide, a physician's guide to the management of HD that anyone can go out and send to their own doctor, even if they're a doctor that isn't really skilled on Huntington's, to learn more about it and to reach out to other professionals that might know about it.
Why is it that Huntington's disease takes a backseat to other conditions, like, as we mentioned, ALS and Parkinson's?
I think there's more publicity around the ALS and the Parkinson's because there are some very well-known people that have had these diseases, Lou Gehrig and Dwight Clark now, and, Muhammad Ali, Neil Diamond, they're out there and they're publicly talking more about it. And Huntington's disease, we all know Woody Guthrie had it, but the younger people probably don't know as much about Woody Guthrie.
Right.
And so we've had a few, Trey Gray from Brooks and Dunn, he was a drummer, and Mariana Polka, who's an actress. I think it's just we don't have as many people affected by Huntington's. It is a more rare disease. So I think that's probably why a lot of people haven't heard about it.
Well, the good news is it is rarer than the other ones, and that's why you're not getting the attention that the other ones are. But yeah, boy, that's
good point.
Funny the way that works, right?
Mm-hmm.
Well, let's talk about the importance of HDSA to the Huntington's disease community.
Okay. So we are, HDSA is a nonprofit organization. and they're dedicated to improving the lives of everyone affected by Huntington's disease. And we do community services, education, to advocacy and research, and they're really focused on providing help for today and hope for tomorrow.
Well, let's talk a little bit about the Huntington's Disease Parity Act. Why does that need to be signed, Dawn?
So the Parity Act is to end the 2-year waiting period after qualifying for SSDI, which is your disability benefits. Right now, someone with Huntington's who's diagnosed will then have to wait this 2 years. And people with Huntington's, they're younger. So they haven't had a big career already, right? They're being shot down kind of in their midlife,
Right.
stopped working. And so right now, the only exceptions to this 2-year waiting period are for end-stage renal disease and ALS. So we are hoping to get this act signed so that people that are qualified for SSDI do not need to wait the 2 years anymore before getting on Medicare.
Boy, yeah, that doesn't make any sense at all. I mean, 2 months would be a long time to wait rather than just an entire 2 years. Are you kidding me?
Correct. I mean, this disease needs, medical guidance. It sometimes needs medications, which are very expensive to help with the symptoms. So, it's a very important act that we need to get signed.
Well, what's your message to members of Congress who haven't co-sponsored the act yet?
Really that 2 years is too long for HD families to wait. We need these members of Congress to follow the lead of our representatives, Pascrell and Kingsinger, and step up and support the bill.
Well, tell me what's going on next Saturday at Riverwalk Park, Don.
So next Saturday, we have our, our grassroots fundraiser. It's the Sacramento Team Hope Walk, and we do these walks all over, the different cities. And this is the one that's going to be in Sacramento. It starts at 9:30, and we are hoping, to have at least 100 people there next Saturday. To really show awareness for Huntington's disease. Everyone will be, getting a T-shirt when they register, and it'll just be a fun event, I think, for people to gather. We did have it in person last year, but prior to that, we had a couple of virtual ones. So,
Right.
Really getting together in person is just, you can't really replace that.
No question about it. It's going to be great to see everybody in person. And in case someone's listening right now, they haven't been to one of your walks, where do we park? Take me from start to finish there, Don.
Well, there's a lot of street parking. It's at the Riverwalk Park near that big yellow bridge down there in West Sacramento. There's a lot of street parking. There should be plenty for people. We're also, trying to get the garage next door to parking in. And then they just, come right up, and there's big registration tables. It's easy to find for sure.
And how long is the walk?
The walk is probably less than a half hour. The event goes from about 9:30 till noon. So, you can still have the rest of your Saturday to do something else, but it's a great cause to come out and, show your support for this small but mighty community that we have.
Right. Is there vendors, or what's going to happen? What else goes on besides the walk?
So we will have our Center of Excellence is there. We're going to have UC Davis Health. We're going to have Kaiser Permanente. Primerica will be there. So we have a few people that are also sponsoring our walk that will be there, that you can learn more about how they play a part in helping with the HD community. And we will have raffles and silent auction items. We have a great silent auction item that was donated by the Sacramento Kings. So that will be an awesome silent auction item. So lots of fun to have with the raffle and things like that.
So you're telling me I can raise money for the cause and also win some cool stuff.
Absolutely.
Outstanding. You're listening to The Public File. I'm Doug Thomas, and my guest this morning is Dawn Green. The Sacramento Team Hope Walk is going on next Saturday, September 24th at Riverwalk Park in West Sacramento. Find out more at HDSA.org/teamhope. THW Sacramento, and that THW stands for Team Hope Walk. Well, you touched on this a little bit, Dawn. Let's give your sponsors some love, and can you use some volunteers?
Well, we can always use some volunteers, which you can go to that link that you talked about, and you'll find information of how to contact us if you'd like to help with us on that walk or future events that we have. Who's sponsoring us for the walk is a few people. We've got UC Davis Health, Kaiser Permanente, Midtown Financial, Bright Ideas Home Staging, Lincoln Skate and Bike Association, Blueprint Realty and Mortgage, Primerica, Genentech, Teva, and Unicare.
Well, let's talk about the latest news, the latest HD trials. How do they affect you, Dawn?
So they affect the community more so than they do me personally. As I said, I really don't have an actual impact. My family's not impacted any longer with Huntington's. But I think for the community, news when you have to change your course in some of these studies that we have can be really frustrating. But I think we have hope that they're going to be able to correct some of these, studies and get back out on it. There's so many research studies right now, more than there have ever been. So I just say, don't lose hope that, these trials will continue, maybe just in another modified, version of them.
You also touched on this a little bit too. What are your thoughts about the local HDSA Center of Excellence at UC Davis?
Well, we partner really closely with the UC Davis Center of Excellence. They are, one of our sponsors. They come to our events. They're so close to our community, and everyone really has, love and support for these doctors and social workers. The clinic is one of the largest in the country, and it's led by the UC Davis facility members of the Department of Neurology and Psychiatric. In addition to clinical care, the patients also have access to emerging new treatments through clinical trials.
Well, let's talk a little bit more about the Northern California chapter and what you do for the HD community.
Well, we have 14 very hardworking, all volunteers that are working toward this organization's mission, which is to improve the lives of everyone affected by Huntington's and their families. And we organize education events, fundraisers each year. And these go towards resources for our families that are in the community, such as support groups that are really helpful to families, and their support groups, or their support systems, should I say.
Well, in case someone's just joining us, they're just pouring their first cup of coffee, what can you share about the Sacramento Team Hope Walk next Saturday?
So the Hope Walk, the Sacramento Hope Walk, is our signature grassroots fundraiser. It's going to be next Saturday, 9:30. We are looking to raise $42,000. We're about halfway there. And so you can register through the Sacramento Team Hope Walk site. It's $30. You'll get a beautiful T-shirt, and there's just going to be a lot of community awareness, and you get to touch base, I think, with a lot of people you might have seen on some of your online support groups or wherever, because really once this community gets together, it's just a great way to share.
And as you mentioned, in person for a change, right?
Yes.
So much better than
So
online.
Nice. Yeah, virtual walking is just not the same as the in-person walk. It's a short walk for people. Obviously, we know we have people that are affected by Huntington's that are coming to the walk, so it's very paved. It's very easy walk for people to do, and then we'll have lots of raffle and silent auction items for people. And you can then engage with some of our professional people that are going to be there, like some of the neurologists at UC Davis and Kaiser Permanente will be there as well.
What are some of the goals for the event next Saturday?
Well, the goals are, obviously we're going to try to raise this $42,000, that will help the families that are affected by Huntington's, and really to give awareness to this disease and share different resources for people that come to the walk. We'll have a lot of resources that people can talk to other people about, or grab, pamphlets and, these T-shirts that people wear, even though some of us have, 20 of them, they're going to wear these outside of this walk, and people are going to ask, what is Huntington's? And that awareness just is golden.
All right, I got to ask, though, how did you come up with the number 42,000? Are you guys big fans of Jackie Robinson? Is that the deal?
Yeah, that's a good point. You know how the math budget people work.
Right. They crunch the numbers, they use the pencils, and that's the number we need to come up with next weekend.
Well, we just look at what our expenses would be for the day and really what we would need to help support the HD community, with things like support groups and other things that we use that money for.
Well, Dawn, in case someone's just joining us, tell us exactly what is Huntington's disease and how you're affected by it.
Well, Huntington's disease, also referred to as HD, is a brain disease that is passed down in families from generation to generation. It causes deterioration in a person's physical, mental, and emotional abilities, usually during their prime working years, and there's currently no cure. There's also a form of juvenile Huntington's disease, which affects children or young adults. It's really described as having ALS, Parkinson's, and Alzheimer's simultaneously.
My goodness, that's not exactly fair.
No, it's not at all.
Yeah, my mom and dad are both dealing with dementia. Mom's got Alzheimer's on top of that, and that's a handful right there. So, but yeah, you take Alzheimer's, ALS, and Parkinson's and wrap it all into one nice little ball, and it turns into Huntington's disease. Is that right?
That's right. Horrible disease.
Yeah. Well, let's talk a little bit more about the process of getting tested for HD.
Okay, so the process it's very simple. It's a blood test. The blood test will determine whether you have the gene for Huntington's or not. And although it's very simple, it can be a really agonizing and personal decision for someone to make, whether they want to know whether they have Huntington's disease. And of course, there's a lot of testing that's done ahead of time before they do the blood test, or shall I say, counseling.
Right.
Because for someone that isn't symptomatic, knowing that you're going to have this disease that could appear usually later in life, it can be very devastating to someone and change their course of life. So, it's a big personal decision whether people really want to know or not.
Well, and I've heard of Huntington's disease my whole life, but until we had our conversation, I really didn't know exactly what it was. And so, man, to find out it's just nasty, like you said before, a combination of ALS, Parkinson's, and Alzheimer's all rolled into one. But I think the big red flag for me this morning was when you told me that there's a such thing as a juvenile Huntington's disease.
Yes, and that obviously is a very devastating, can happen, again, in children and young adults. And, sometimes that has actually been how the parent finds out that they had Huntington's. A lot of times Huntington's is not something that people know was in their family. Again, it's passed down. It does not skip generations. So there have been cases where a child has been diagnosed with Huntington's, and then the parents are like, well, where did it come from? Because it manifests so early in them, but the symptoms had not started in the adult yet, and they didn't know they were at risk.
My goodness, that is a nasty disease, no question about it. Well, you guys are doing everything you can to fight it, so tell me what's going on next Saturday at Riverwalk Park, Dawn.
So next Saturday, we're having our Sacramento Team Hope Walk. This is a signature grassroots fundraiser campaign designed to provide hope and support for those touched by this devastating disease. All proceeds support HDSA's mission to improve the lives of people affected by HD and their families. It's happening on September 24th, starts at 9:30, and this event has raised more than $22 million since the inception in 2007. And it occurs in over 100 different cities. So Sacramento, it'll be there next Saturday.
Let's go back and talk about the importance of HDSA to the Huntington's disease community.
HDSA has been very important to the community. It's a nonprofit organization. It's dedicated to improving the lives of everyone affected by Huntington's. It does things from community services to education, of advocacy and research. It's really providing help for today and hope for tomorrow.
All right, you've got the big walk coming up next weekend, and we're running out of time, believe it or not. So what would you like to leave our listeners with this morning, Dawn?
Well, I really would love to see everyone come out on September 24th, share your support. We're a very small and mighty group, but we'd love to see you, whether you have Huntington's or not, or you know of it, come out, learn more about it, see how you can help. We just need people to get involved and to have hope that we're going to find a cure for this disease.
Absolutely. Well, thank you.